Congratulations. This is part 3 of your medication technician training, and this is your final part. Let's celebrate. So, in this section, we will talk about common medications, indications, side effects, and adverse reactions. You will often get a drug information pack when you go to like the pharmacy, CVS, Walmart, Publix, wherever. They will staple a bunch of papers onto the bag. That pamphlet is the drug information. If you open it up and actually look at it, and I know most of us don't, then you'll see what the drug is for, what the brand name is, some side effects, what to look for if things are going wrong. You'll see all of that in that drug pack. Cardiovascular medication. So the cardiovascular system is the heart and the blood vessels. In this system, you will have some drugs that vasodilate. Vasodilation means that it's opening up the blood vessel. This treats chest pain, it treats high blood pressure. You might give some medication that is a diuretic. That helps eliminate salt and water, that also treats high blood pressure, CHF or congestive heart failure, and glaucoma, all of that pressure with the glaucoma. You have antihypertensive medication that lowers blood pressure. You have antiarrhythmic medication, which will treat the irregular heartbeat, and anticoagulants. If you have like blood clots, it's going to help to reduce the blood from clotting, or if you're at risk of stroke or heart attack, then it's going to try to reduce that risk. If we think about like the anticoagulants, this could be medication like warfarin, but it could also be medication like aspirin. And if they have two anticoagulants together, then you as a med tech need to look at that to see if this is correct. You may need to talk to the nurse, to talk to the doctor, just to make sure that they don't have a lot on their plate and their blood is going to be too thin when they get cut. They might bleed, bleed, and bleed and can't stop. Respiratory system. Your respiratory system is your nose, your sinuses, your lungs. Respiratory, you're thinking breathing. So you will have some cough suppressant medication. The cough suppressant medication or your antitussives could be cough drops. It could be liquids like cough syrup. You may have some expectorants. Just think coughing up and then spitting it out. It breaks up the thick mucus in the lungs and the bronchi, which are the branches of the lungs, to help clear up that mucus. And if you are breaking up the mucus, it's going to have to come up with the coughing. It might come up into some person's mouth and they can spit it out. Decongestants, antihistamines, it reduces the lining of the swelling in their nose. It helps to dry up their mucous membranes if they have too much mucus. And then bronchodilators helps to dilate those branches in their lungs and nasal passages. And that's like your inhalers and your nebulizer treatments. So medication for skin. So this could be where you have the skin lotions, the creams, the ointments, the powders. So your protectives cover, cool, dry, soothe inflamed skin. Your antipyretics, it helps to relieve itching. I'm always thinking, or itching from allergies, skin conditions, and insect bites. I'm always thinking of like Benadryl. Not the Benadryl that you are ingesting, maybe, but the ointment, Benadryl ointment that you put on that insect bite to help so you won't itch and scratch and scratch and scratch. Uh, Anti-inflammatory, your topical corticosteroids. It helps to relieve itching. It helps to reduce that irritation and the reaction. Anti-infectives kills or inhibits the skin infections, the organisms that help to actually produce and reproduce those infections. It will stop it from happening. Same thing with other germs and fungus on the skin. And then the parasitals. I always am thinking about scabies, but skin scabies. So you always think lice, right? So if you are thinking lice, that's in your hair. Skin scabies or skin lice is scabies, and that is a shampoo that you can use to kill that parasite. And then you have to baggage all of the clothes of the person and pretty much treats everything. But for them, they will have a shampoo for the hair and a soap for the skin to kill the parasites, the skin lice or the scabies on their skin. Urinary system medication, you're always thinking urinary tract, your kidneys, your bladder. So if you have antibiotics, if the client has a UTI or bladder infection, diuretics that will reduce the water and salt intake, and then your analgesics for pain. If they have a lot of pain, if they have a UTI, then they might be on some pain medication. Excuse me. Just with just a note, the one of the analgesics is Peridium, and you give Peridium to reduce the burning sensation if they have a urinary tract infection or UTI. The Peridium will turn the client's pee a bright orange color or a bright blue color. I have never seen the blue. I have always seen the orange color, but just know not to be alarmed. And you can also warn your patient or your client too. When you pee because you're on this medication, your urine is going to be super pretty bright orange. Don't think that something is wrong. It's just because of the medication and it's working. But it also helps with pain, so they shouldn't feel a lot of pain the next time that they go to the bathroom. Gastrointestinal system. So your gastrointestinal is mouth, throat, esophagus, stomach, all the way down to intestines, and then out out of the body through the backside, through the rectum. So you could have medications that treat ulcers, irritable bowel syndrome, colitis, or the inflammation of the GI tract. We also will think about if somebody is having diarrhea, we need to slow down that diarrhea. Or if somebody is constipated, we need to do the opposite to get them to go. So with your GI or gastrointestinal system medication, it could range from slowing down, speeding up, inflammation. Just know what you're giving and know why you're giving it. Know what the side effects are. um, Endocrine system medication. Endocrine is more like hormonal. Um, so you have your oral anti-diabetic medication that controls the blood sugar. If it is a oral medication, but it's for diabetes, you can still give it, okay? Just be sure that you know what the order is. Do you need to check a blood sugar before you give this oral diabetic medication, or is it okay to just give it? Do they need to eat? Do you need to record before and after? The injectable anti-diabetic medication, this will come in rapid, intermediate, or long-acting injectable sites. If it is an injectable, we cannot do anything with it. Okay. Um, if you have some people will have insulin pens, and most people now have insulin pens. And when you come for the in-class portion, I'll show you what the insulin pen looks like. If there is an insulin pen, then you can clean that area wherever the insulin is going, and you can look at the insulin pen and remind them that they need to do it. But you cannot inject that site. The client has to inject the site, or a family member or something. You cannot do that. Okay. And then hormonal drugs for thyroid issues, pituitary issues, adrenals, pancreas, ovaries, testes. You can give those types of medication. Nervous system medications. So with your nervous system medication, be thinking about brain disorders, nerve disorders. So seizure disorders, psychiatric medications, Parkinson's disease, um, Alzheimer's disease, those type of diseases you can give medication for. Um, know what you're given, know why that you're actually giving it, and also know that like your psychiatric medications, one drug could work for both anxiety, but it could also work for like ADHD. If you're giving it for the anti-anxiety, then it needs to be written for that, and don't give it because somebody has ADHD too and they need to help with focusing. Okay. Side effects of medication. There are mild side effects. You can have moderate side effects, or you can have severe, serious side effects, which are also adverse reactions. So the mild, moderate side effects, those are good. Some of them are good side effects. Your side effect of taking a medication could be it lowers the um, blood pressure. Yeah, that's what we want, right? But your adverse effects or reactions or your allergic reactions, those are things that we're worried about. With that, if someone has severe allergic reaction, they might have EpiPen ordered. So EpiPen, you're going to have hands-on when you come to the in-person class, But with your EpiPen, this is the only injectable that you can do, the only shot that you can do. Allergic reactions, some mild allergic reactions are runny nose, sneezing, itching, rash, nausea, vomiting, diarrhea. Or you could have shock, anaphylactic shock, life-threatening reactions, flushing, rash, itchiness, tingling of the lips, the tongue, swelling of the tongue, lips, throat, racing heart, dizziness, anxiousness, feeling of doom, like something bad is getting ready to happen. Your airway could close and you could collapse. If you're using an EpiPen, call 911. If you're thinking about using an EpiPen, call 911. EpiPens are the only injectables that you can do, and EpiPens are only for that person that it is ordered for. Okay, so you're not going to get an EpiPen from Miss Johnson and give it to Miss Walker because Miss Walker is having a reaction to something. It was written for Miss Johnson, so that is hers. All right. Medication errors. A medication error is a preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Common kinds of medication errors, you have your prescribing error, dispensing error, and administration error. Prescribing errors. So these are errors written by your advanced practitioner. So it could be your doctor, your PA, your nurse practitioner, your dentist. What did they write? Maybe they wrote the wrong drug. They wrote the wrong dosage, the wrong route, or they used the wrong abbreviations, or the abbreviations were misinterpreted. So you these days, because most of the prescriptions are sent electronically, it helps to reduce the amount of errors. But sometimes you will have those prescriptions that are still written that you have to take to the pharmacy. So it might be error handwriting that you just can't read. Dispensing errors. So dispensing is from the pharmacy. This is crazy. 14% of medication errors are, or medications are dispensed incorrectly. 14%, that's a lot. Communication is key to preventing dispensing errors. So the communication means that you should look at the piece of paper that says whatever color it is, or if it's round, or should it have a number on it, and look at the medication itself and talk to the pharmacy tech to make sure that this is what it says it is. Administration errors, this is you. This is you administering all of those medications to that person. So you're going to have to be alert enough to find the error and prevent it before it actually ends up being a real error. Medication errors are dangerous. Harm can be as simple as a rash up to something that's life-threatening. And all it takes to cause harm is one incident. Let's look at this error from something that happened. Jacob has been taking Depakote 500 milligrams, 2 tablets by mouth twice a day for seizures. Recently, he started having breakthrough seizures, and his dose was increased to Depakote 500 milligrams, 3 tablets by mouth twice a day. When the order was written on the MAR, the error was made and it was written Depakote 500 milligrams by mouth twice a day. instead of adding to his dose. This error cut it in half. So originally he was taking two tablets twice a day. Then he went to the doctor and they wrote for 3 tablets twice a day. So originally he was taking 4. Then he went back. Now he's taking 6. But what was written in the chart was actually 2 tablets twice a day. One in the morning, one in the evening. So it was reduced all the way down from was supposed to be 6 and now it is 2. After taking the lower dose for a week, Jacob had a serious grand mal seizure while eating breakfast and was sent to the hospital by ambulance. During his seizure, he aspirated some food, which caused pneumonia so serious that it put him on a ventilator and spent weeks in the hospital. Then he went to rehab. He remained weak and unable to go to his usual activities for over 3 months. Okay, that is a lot. Common causes of medication errors: not being prepared, having poor lighting, distractions. That's like number one. Talking to other people, looking at the phone, watching TV, trying to do too many things at one time, trying to prepare too many meds at one time, not knowing your clients well, and pre-pouring. So don't do all of this stuff. Don't do dry large TV and cook while you're preparing the medication, and then just throwing a little bit of laundry in there while you're waiting for the client to come to the room if you're doing like home health. Phones are always a big thing with distraction. Here it is again, your 7 rights of medication administration. Right clients. Do you have the right reason, the right medication, the right dosage, the right time, the right route, and the right documentation? Medication error, wrong medication. So the wrong medication could be if you're given a PRN medication that was written for pain, but you're going to give it for fever. You know that it treats fever too, but it's not written for that, so you can't give it for that. Or you're giving a medication that you don't have a prescription for. Excuse me. Wrong dose. If you look at this picture, that there is a scored line in the picture, right? So with that scored line, say you were supposed to give 12.5 of that pill, but you really didn't look at the prescription and you know that they're supposed to have it, so you gave the whole thing. The whole thing is not 12.5, the whole thing is 25. So you gave the wrong dosage, which is a medication error. Wrong person, you just simply gave it to the wrong person. Being too busy, being distracted, or setting it down and another person picks it up and takes it. Wrong route. The wrong route. Eardrops and eye drops look the same. You do need to pay attention to make sure that you're giving an eardrop in the ear instead of giving an eardrop in the eye. Wrong time. You have an hour before and an hour after to give medication. So if it's scheduled for 6, then you can give it at 5 all the way up to 7. But if you are like really behind and you have to give something at like 9 o'clock, then it is a medication error. Medication not given. With the medication not given, it could be from a lot of things. Patient refused, you just didn't give it, it wasn't available, it wasn't filled within the 24 hours. Remember, we talked about that earlier. The pharmacy didn't have it. It wasn't refilled on time. There was an insurance issue. The family didn't want it to happen, or they didn't give it. A lot of reasons why. Um, Documentation, it wasn't documented appropriately, or you gave medication at a route which you're not validated. Giving medication that is expired is also an error. And failing to count your controlled medication. Not every medication is controlled. Most of them that are controlled medications are like narcotics. Some antipsychotic or psychiatric medication are also controlled. Pain medication are also controlled. Medication error, what do you do next? You notify your supervisor, you follow the agency's policy or whatever your facility's policy is. If you gave the wrong medication or the wrong dose, or you gave it to the wrong client, you will need to call the healthcare provider for the client and let them know immediately. Observe them for a minimum amount of time of an hour, 60 minutes, and immediately report changes. And if needed, go ahead and call 911. If they're having some difficulty breathing or life-threatening symptoms, call. Don't hesitate to do that. When do you call the healthcare practitioner, their healthcare provider? So these are like 5 different things that you're not going to call for. You can handle it in-house. Um, you're still going to have to talk to your supervisor, though. You don't just kind of hide it or keep it a secret. Giving the medication at the wrong time, not documenting immediately after you're done, giving expired or mislabeled medication, not counting controlled meds, and medications given by an unvalidated med tech. If you're thinking about it, the practitioner doesn't really need to know any of this. That does have to be dealt with by your supervisor. When you're calling their healthcare provider, make sure that when they give you a response back, they can give you a response back on the phone, but make sure that they also fax something over or put it in writing for you. Okay, so you can have some written documentation, a paper trail. Documentation. This is a documentation of the medication error. You need to document who discovered it, patient or the staff members that are involved, medications that were involved, name, dosage, times that it was given, what the medication was, what is it a um, wrong person error, the wrong time error, immediate action and intervention, what happened next? What did you do? Did you call the doctor? Did you talk to the supervisor? And then what happened after that? Did they have to go to the hospital? Did they have any medical care required? Um, and then how did they fix it? How did your facility fix it for the next time? If the medication error occurs in the facility, you must submit copies of the medication error report to the facility administrator within 24 hours of discovering the error. And some sites are different, some facilities are different. So follow the policy. If a medication error occurs in a client's home, you need to submit that error report to the supervisor within 24 hours of discovery of the error. And then for a controlled medication count, you must let them know, I would say within 24 hours after discovery. And actually, with the controlled medication count, I would say let them know immediately because you don't want the next person coming on to be counting and it be off for 2 days. Because it will involve too many more people, too many other people. About medication refusal, clients do have a right to refuse medication. It is not really a medication error that you have to report to the supervisor immediately, but you do need to start reporting and recording, and that is your initials with the circle. The doctors do need to know eventually that your patient isn't taking their medication because they will correlate why is the blood pressure still so high or why is their blood sugar still high and add more drugs to them instead of reevaluating why this patient isn't even taking this medication, what the issue is, and how we can change that to make it better. These are examples of medication storage units. With the medication storage unit, it needs to be centrally stored. It should be locked in an area at all times. Controlled medications will be double locked, and we'll look at that in a minute. Medications must be kept in their original or legally dispensed labeled packaging, including the over-the-counter medications. Each client's medication must be returned to its portable or permanent storage unit immediately after giving the medication. And each client's medication must be kept separately. So you can't keep, okay, separately in the same storage, huge storage cabinet, but in different sections. All of the client's non-controlled medication must be kept together with oral medications and non-oral medications separated by using like a Ziploc bag or separate container within the client's medication storage space. Medication storage areas should be free of dampness, abnormal warmth, and away from like direct sunlight so no damage or harm can come from the integrity of the medication. If meds need to be kept in a refrigerator, it has to be a separate locked refrigerator that is not the same refrigerator that you're putting your food in. This is a refrigerator just for medicine. Medication keys should be kept by the med tech or the nurse giving the medication. It should be somewhere that is not accessible to any clients. So this is an example of the double lock. You have lock one here that is a huge lock that's on the outside of the container. And after you open it, then you have your second lock, and this is where the controlled meds would be. So if I had some non-controlled meds, then it would be out here. And then if I had some controlled meds, it would be in here. Destruction of medication. If you have expired medication or medication that has been discontinued, you can't just throw it in the trash. It does need to be recorded and also disposed of correctly. So you're going to do your date, your name of the medication, your dosage, how many are to be destroyed, how are you going to destroy them, and we'll look at that in a minute. Was it discontinued by the prescriber? Was it expired or out of date? And then two initials here. So in um, our pharmacies, CVS, I know CVS and Walgreens, they have a take back program where you can just take whatever you need to take to CVS or to the pharmacy, and they will take it, or they'll have you put it in a box. If you don't want to do that, then you can take the medication, mix it with some kitty litter or some coffee grounds, excuse me, mix it with some water, and then package it up, bag it up, and then put it in the trash. With this, even if it is a controlled medication, it won't be like something that somebody can take out and get the actual pill and take it. It is already mixed up and solidified with the coffee or the kitty litter. And that is the end of your medication technician annual training. Thank you so much for being with me these last few hours. I hope to see you all soon next year for your training. If you have any questions or want to pursue any type of healthcare in the future, contact me. My name is Nurse Sharina, and so I will talk to you all later. Bye.